Now, just days after a video went viral showing a senior health official in South Africa berating a Zimbabwean woman for seeking health care in the country, foreign nationals have now been stopped from receiving health care. The incident took place in a hospital in Kalafong near Pretoria, and it is said to be people who are behind, who are members of Operation Dudula.
Now, Operation Dudula has called itself a patriotic organization. However, some rights organizations have flagged it for xenophobia. The members of Operation Dudula say the services of the hospital should be limited to those originating in South Africa.
Meanwhile, following the viral video, there are now calls for Limpopo Health MEC Kofi Ramatuba to step down. Well, joining us to examine the story is Vinayak Bhardwaj. He's the Regional Migration Advisor for Doctors Without Borders in South Africa. Good morning, and thanks for joining us, Mr. Bhardwaj.
Good morning, and good morning to your viewers.
All right. MSF, recently spoke out against those protesting in Limpopo who are limiting access to migrant patients who want to enter, or rather gain access to the Kalafong hospital. How did this all begin?
So, the Kalafong-related protest, we understand, began on the 8th of August by a group claiming to be the Attridgeville sect of the Operation Dudula. And we know that the Operation Dudula itself emerged in 2021 in Soweto, and we've been observing its emergence with some concern. That's about all we can really say on this one.
Okay, we unfortunately will be looking at a conversation concerning the reactions of the health minister, the Limpopo MEC. Now, last week we did talk about it on the show, and we had a representative from Zimbabwe speak to us about this. I'd like to find out your thoughts on the statements by the MEC. Do you see any merits to our arguments?
Well, I think that ultimately the decision about how the South African government decides on packages of medical care is one that it should make based on its constitution. And in the South African Constitution, Section 27 guarantees access to health to all. The National Health Act guarantees free access to essential services to all, regardless of documentation status. And so we see the Limpopo MEC's statement as a departure from South African government policy and constitution and all the major guiding documents that determine the health response of the South African state. So as MSF, we think that there's a real departure there. Additionally, we feel that the effect of such statements can be to give strength and confidence to groups such as Operation Dudula, who would rather see healthcare distributed not according to the best principles and highest ethical standards of medical care, but on the basis of national identity, which in the case of Africa, as you know, is a colonially determined prospect.
I mean, you've just mentioned that healthcare should be given to all, but does it matter if what the MEC, Limpopo Health MEC, Dr. Kofi Ramatuba, did say in terms of explaining the budget, the budgetary allocation, and the fact that the woman, the Zimbabwean woman, was an illegal resident? Does it matter? I mean, you've explained to us what the position should be as regards healthcare for all, but should that be based on the legality or otherwise of the person who is in need of healthcare?
You're absolutely right that there are budgetary implications to providing medical care, and that is why the South African state has means tests for all people, not just foreign nationals, but even local South Africans in accepting care in state facilities have to pay something for non-essential services. But where essential services, emergency services, and services for maternal and child health care are provided for free, it's true that these are decisions that are based on that there are budgetary implications for those kinds of decisions. What we would say as MSF is that ultimately the decision about what kind of care to offer patients is one that clinicians make all the time, and they do make those decisions in resource-scarce environments. However, deciding on who should and shouldn't get particular services should be based on medical needs, not on national identity, because otherwise you risk making health workers do the job of immigration officers and you turn hospitals into sites of detention and deportation. And that's not ideal for public health at large. It will make sure that people who are having notifiable conditions, so if, for example, somebody has measles, they might be reluctant to seek care. And as you know, measles is a disease that rapidly spreads in communities among people who are not vaccinated. And you would end up having a measles epidemic on your hands. This is not an abstract fear. There's a measles outbreak currently going on in Zimbabwe as we speak. So I think that the MEC is misguided to the extent that she thinks that decisions about whether to offer care to a vulnerable patient should be made on the basis of his or her nationality. Instead, those decisions need to be made on the basis of medical needs. And these are needs that clinicians in South Africa are very capable of identifying. South Africa has a highly professionalized and very capable health worker cadre.
All right. Is the MSF, able to help the foreign nationals who are turned away? Because I'm guessing that's going to put more work on your hands. So, how do you plan handling these extra responsibilities?
So we currently do provide care to not just foreign nationals, but to anyone who comes to us, and we provide care for free, of course. Our challenge is in a scenario like South Africa, where you do have a very capable health sector, both in the private and public sector. The things we tend to focus on are those that are not really attended to by the health system at large. So there would be tertiary services like cancer treatment or surgical procedures that we would not be able to provide assistance with in our health facilities, or we don't own any health facilities, but through our health services. But all the work we do in South Africa is in collaboration with the National Department of Health, and where we are located in the 3 or 4 provinces in South Africa with the local provincial departments of health as well. So for those who are turned away, we would certainly advocate for them to be included in the system. And for those who cannot afford to pay, we are often trying our best to either support them ourselves or try and find ways to activate a community response to pay for those services. But yeah, it's a challenge for everyone. We acknowledge that.
Can you also, before we we'll end this, can you also speak more on the group that has been accused of xenophobia now because of their actions?
You mean Operation Dudula?
Yes.
Well, there's not much to say really, in the sense that we understand there are now some sort of group that has coalesced around the issue of migrants' legality in South Africa, to the extent that their actions impact on migrants' access to health. We stand strongly opposed to those actions. We strongly believe that healthcare is a human right, and we strongly believe that access to healthcare for all, regardless of documentation status, is essential to achieving universal health coverage and all the other important goals that South Africa has set for itself. Right. So in that sense, we do criticize them. We don't, however, we don't pronounce on the right of South Africans to determine their immigration laws. That is for South Africans to determine.
All right, Vinayak Bidwat, thank you so much for the work that you do with you and your team are doing, and we look forward to having you again.
Thank you very much for having me, and thanks to you, viewers.